origins of acupuncture began in China about 3,000 years ago. Farmers started using it on their workhorses. So the Eastern philosophy believes there's an imbalance of yin and yang that results in disease. So this represents yin and yang. We've all seen this before pretty much, right? The yin is dark and the yang is light, and they're polar opposites. When they're in balance, as represented here, there's health. If one is overshadowing the other, that's an imbalance. There's a disease process going on. In Chinese theory, they believe the life force qi, okay, is what helps the balance or the flow of energy. Qi is the flow of energy, and it helps keep yin and yang in balance and check. Yes?
Back to the meridians, are they similar for a cat?
Yes, yes, yep. So acupuncture, the point of acupuncture is to diagnose your imbalance and try to even out the imbalance, to get back to your balanced state here. Okay, that's the Chinese or the Eastern philosophy. Tools of the trade, dry needle acupuncture is most readily used. That's just insertion of very small needles, different size based on the size of the animal. Of course, acupuncture needles are much longer than, like, say, a needle you would use on a cat. Aqua puncture is the injection of, say, B12 or even saline right into the acupuncture point. It's good for animals that don't like to sit long for the needles, in them for long. It's also thought to sustain the effect of acupuncture because it's like a constant stimulation. It's leaving a little bleb, something to constantly stimulate the acupuncture point with that fluid for a longer period of time than versus when you take the needle out. So it might be help with a sustained effect. B12 is also a tonic. We also use lasers and lacers to stimulate acupuncture points. And Electro Acupuncture is great for disc disease, herniated discs and backs, things like that. So that's when you're actually hooking up electrodes to the acupuncture points and getting a mild effect with that. So how does it work? By Western standards, so conventional standards, how we're trained as veterinarians in this country, acupuncture evokes the immune system to release compounds, natural compounds that are produced in our bodies, obviously, that facilitate healing and aid in pain relief, okay? All right, so this is the one we take your pencils out. We have a quiz at the end for this. Just kidding. It's just a nerdy joke. Sorry. Anyway, what this graph represents is the physiologic underpinnings to acupuncture. Okay, so this has nothing to do with the yin and yang, right? It's just biologic and how we're to understand it by conventional means. So right here you just see, basically it's broken down into two things. This is just the needle insertion here, okay? This is a cascade of compounds that affect the central nervous system. So it's going to affect the brain and the spinal cord, right, directly. And then you also have the needle insertion and a local effect. So this is affecting the peripheral nervous system. That's all this slide is showing. What you end up getting is an upregulation or a release of prostaglandin 12, which is a very important prostaglandin. It protects healthy tissue, okay? But you also get a cascade of compounds released that are analgesic or anti-pain, anti-inflammatory, that help regulate homeostasis, which is just like, regulating the ins and outs in cells. And all just anti-inflammatory factors. So this all aids in promotion of healing. What I'll talk about a little bit later is the one benefit to acupuncture we have over just using non-steroidal anti-inflammatories, and I'm not against non-steroidal anti-inflammatories. Remember, I'm an integrated veterinarian. I'm just saying one of the reasons I like to promote acupuncture as well is whereas some non-steroidal anti-inflammatories can block the synthesis or release of certain prostaglandins like prostaglandin 12, which can protect tissue. So they can actually block, they aid in inflammation. They're definitely anti-inflammatory, the non-steroidal anti-inflammatories. However, they might block the protective effects of certain prostaglandins, like prostaglandin 12, where acupuncture does not do that. So what animals can benefit from acupuncture? In this country, the most widely used is for arthritis and degenerative joint disease. Hip dysplasia response great. It's great for disc disease. The quicker you get a dog in with a herniated disc and started on acupuncture before or after surgery, the better. Neck pain, skin disorders, kidney disease is great. Liver disease, even inflammatory bowel disease can benefit from acupuncture. Basically, any disease process in theory can benefit from acupuncture. If you have an acute injury, you can identify the trigger points and needle those to help relieve muscle spasm. It will, relieve pain and facilitate healing. It can aid in post-surgical healing because you're going to improve circulation, you're going to decrease swelling. Remember, we're going to not block the healing effect of some of those good prostaglandins like prostaglandin 12, and that's what we're talking about here.